really something very, very important. So when that is being done, they can have the best support they need to actually develop to the greatest potential that they have.
Just before I go back to the doctor, do you also work hand in hand with maybe medical practitioners, or you just focus majorly on their academic needs?
Well, we do work with medical personnel. Like I said before, um, we have personnel who are certified um, to run tests. We have educational psychologists who would assess students, children, and certify that they have some certain specific disabilities. Then we now take it up from that report. So that report gives us an idea of how to develop IEPs to meet that specific need that is to be met for that child.
Right. Thank you very much, Isaac. Now, speaking of medical practitioners that are involved in this particular process, Olubusayo, after a parent, a guardian notices that some things are not right with the pace of this particular child, they're not doing things that are age appropriate. After you have noticed something, and it's time for you to seek professional help, what are some of the techniques, or what methods, or what kind of tests are conducted so that it can be verified that okay, this particular child is struggling with a learning disability? Busaya, that's for you.
Okay, so once the child's parents are seeking help, most times they go to a developmental pediatrician or a neurologist, and what they'll be looking out for is reading special skills, like that, to see if they are the aspects at which they are having challenges. You understand? So they get assessment in cognitive skills, they get assessed in reading skills and math knowledge, basic age appropriate skills, so that they'll be able to assess in at what age is are they reading. Do you understand? Because you can actually have a 5-year-old child who is going to be reading like 6 months cognitive skill, so that that's going to be like a baseline for professionals like us to know where we are going to be picking for. Though that is a medical report, so once it comes to you, you still have to do a baseline assessment so that you know where you are starting from. But most times when you are having challenges with those kids, their cognitive skill is always below their age. So you need to know at what point they are for you to be able to know where to start from. Yeah, that is it.
All right. Thank you. Thank you very much for that explanation. If you're just joining us once again, Mother and Child is the show. Learning disability is the topic. My name is Sage Babalola. I do have representative from the Learning Support Unit of British International School. I have Uzioma Ike, who is the head of Learning Support and a certified dyslexia and autism specialist. Also here with me in the studio is Isaac Unwali, who's the assistant head of Learning Support and is also a certified dyslexia specialist. I also have students from British International School, Teramola Uluwatuyi and Mufara Tireoluwa Kola Alabi. Now, to give us more insight into, the medical aspect of learning disabilities is Olubusayo Temitokwe Osoba. She's an interventionist. She's the founder of ReCare Helpmate Services. She's a certified behavior analyst and an international behavior analyst as well, with over 15 years of experience. So let's talk about difficulty with memory retention, because I know that even in the signs and symptoms they struggle with learning, and some of which might involve the inability to hold on to certain memory. So is difficulty with retaining memory a learning disorder on its own, or it's simply the manifestation of a learning disorder? Busayo, I would like you to address that before I throw the question to Isaac and Uzioma.
So what's the question?
The inability to retain memory. People who forget,
Okay.
children who forget things very easily.
Okay.
Is this a learning disability on
Yes,
its own,
because that's
or
part
a
of
manifestation?
that's part of cognitive skill.
Right.
Most times when you even want to address learning disability, you address from the cognitive aspect. You understand? So as they grow and then they develop the cognitive skills, every other thing falls at par.
All right. So,
That's it. So
all right. Thank you very much. So, Isaac, you could go first, and then I'll talk to Ozioma. You have students who probably, they excel in other aspects, but their primary issue is memory retention. You tell them something this very moment, and they are unable to express it back to you. Do you have cases like that, and how severe are the situations that you've personally experienced?
Thank you. Obviously, that's one of the major signs. Ability to retain to retain information, and usually that's one of the major signs of learning
Learning
disability
disability.
cognitively, and several factors can be responsible. Poor nutrition, anxiety, and probably that child had adverse childhood experiences, which one way or the other is causing that. So of course we from time to time have such children who have challenges with retaining information, and that's one of the major challenge that informs learning disability.
Right. Let's hear from Ozioma before we move on to the next question.
All right, thank you so much. So when we're talking about those that have
The struggle with memory
struggle
retention.
with memory
Yeah.
retention, so we have what we call short-term memory and problem, and we have long-term memory problem. So those that have short-term memory problem, they tend to forget information given to them to use at the moment. So when you give them an information and they are supposed to make use of it within a short period of time, they will literally forget about it. Then those that have long-term memory problem, when you give them information that they will use for a longer period, they will literally forget about it. So when we talk about it affecting learning disability, individuals that have dyslexia, they tend to fight with short-term memory, because you can just teach them something now, in the next 10 minutes or 15 minutes and ask them about it, they've forgotten. So that is short-term memory problem. Then long-term memory problem, when you call them after a month or 2 months and ask them about it, they're forgetting about the information. So definitely it affects learning disability in
Right.
the long run.
Right. Okay. So we know that some of the signs might come up maybe in infancy. If you're a parent or a guardian that's very observant, you might notice from infancy. But then again, there's some people who you do not see these signs manifesting until when they are of school age, and then you start to see their struggles with academics and what have you. That's when you know that okay, there is a problem. But in all your experience, I'll talk to you first before I go to Busayo. In all your years of working with children with learning disabilities, have you ever seen a situation where maybe they outgrow the condition, where maybe it's because of they're young, that's why their struggles are so evident, that's why their struggles are so severe? Have you seen a situation where learning disabilities get better with age, or do you think it gets worse and it gets more difficult to manage as they progress in age?
okay.
Okay.
Okay,
So
learning disability is actually a lifelong disability, but it gets better with age if the child is having intervention services. I hope you understand what I mean.
Yes, I'm with you.
So, so because my child can have a learning disability, and then I'm seeing that the child has a learning disability, and I believe that the child cannot be useful for anything. Then I am seeing that my child has challenges, and I am seeking help for that child. So most definitely, a child that is having intervention services in place will get better. Do you understand? And then it's not a one size fits all, because as Ozioma, I think Ozioma says, we have the severe one, we have the milder one, and then you can actually have someone that will actually, you would even see that person in the next 10 years, you will never believe that the child actually struggled with learning disability. But some are there that in the next 15-20 years, you would actually, it will still be obvious that they have challenges that they are struggling with.
Okay.
That's because
Go ahead. Go ahead.
that's because what affects that child A is not what will affect child B. And so it depends on the severity of the challenges.
Right. So, Ozioma, over to you. The students that you've worked with, did they get better with age, or did they, in a manner of speaking, outgrow their learning disability, or you think it got worse?
Okay, we always encourage parents to do what we call early intervention, because when you give children early intervention, it helps. Like, for example, if a child in kindergarten, you started seeing signs of learning disability, and you didn't do anything about it, it will grow, and the condition will be there even when the child gets to secondary school. But when there is early intervention, you find out that the problem will be curtailed as the child is growing. Okay, it is nothing like outgrowing, because if a child has come to teenage age and you've not recognized that the child has a learning disability, the disability will be there, and the child will even go to the university, the disability will remain. But if you give that child an early intervention and starts working on the disability, you may not see it as the child is growing.
Right. Thank you very much. So let's talk to you, because I know that as much as they work with this, students that have learning disability, you're with them every single day of your life. So as you progress in class, your interaction with them, does it get better? Does it get worse? Are they withdrawn in their behaviors, or are they in their socialization with you as you progress in age in class? Do you find the experience easier, or is it more difficult for you as students who have to constantly spend time around other students that have learning disability? You could go first, and then we have.
I think that with time it gets easier, because if you're around your classmates that have disabilities quite often, you'd be able to adapt to their mannerisms and how they behave on a regular basis.
Okay. Yes, go ahead, please.
Well, I totally agree with her. So yes, you're right. We are there every single day of our life. It also gets easier as time. For example, you don't understand something, you take it to them for them to explain to you, then you finally understand.
Right. All right. Thank you very much, Tera Mola, for that, and also Mufaratiri Oluwa. So, initially, when we started this conversation in my introduction, I did say that there's certain expectations of a child as they reach, a certain milestone. At least you're expecting them to a large extent, be able to cater to themselves, take care of themselves, feed themselves, clothe themselves, and even their communication. So, how do you think learning disabilities, how related to adaptive characteristics, are they interconnected? I know that they might struggle in academics, dyscalculia, dyslexia, their writing, but does this also leak into their adaptive, characteristics of their life? Can they feed themselves? Can they clothe themselves? Are they able to communicate their emotions to you, or all of the struggle is limited to their academics?
Okay, I want to say that there is a difference between individuals with learning disability and individuals with special needs.
Right.
So when we talk about learning disability, it's just individuals that have that struggle with certain aspects of their learning abilities.
Right.
But when we talk about special needs, that's when we talk about individuals that have something like autism and Down syndrome and all that. But individuals with learning disability, they don't struggle with their ability to dress up, to eat, and all that. The only aspect that affects some of them are those that have dyspraxia. Their ability to use their fingers,
motor
their
functions.
their motor functions and all that. But those that have dyslexia, dyscalculia, they don't struggle with dressing themselves and feeding themselves and doing out things by themselves.
Right.
Yes.
Okay. So, Busayo,
Can
I would like for you
yes.
to weigh. Yes, please weigh in on the matter. Students with
Okay.
learning disabilities, does this affect other aspects of their life, or this is just strictly limited to their learning capacities?
Okay, like Ojoma has said, she has said correctly, but you might be seeing, like there's a question here that said, are there related health conditions attributed to? That is what we call comorbid. There's what we call comorbidity. Like a child can have learning disability and have autism. A child can have learning disability and have ADHD. A child can have learning disability and have cerebral palsy, and or Down syndrome. So that's a comorbidity. And so if you are having a child that has learning disability and then is struggling to feed, to dress self, to communication, to run communication, it means that child has another disability aside from learning disability. I hope you understand. So they might have to. That's why most times when we are running assessments, you need to rule out every other special needs before you can run an assessment on learning disability. So you need to rule out autism, you need to rule out Down syndrome or So because they are all, so sometimes some of these things hide under, and then there's what we call comorbidity, so that a child can have autism, because a child can have autism and be able to learn very well, and a child can have autism and still have challenges with learning disability.
Mm.
So that's it.
All right, thank you very much. I think I can understand where you're coming from, because a lot of learning disabilities experts would say that it's somewhat related to even the stage of pregnancy. For example, there are medical experts that would tell you fetal alcohol syndrome, for example, a mother who drinks during pregnancy, it can be some sort of risk factor for learning disability. So if we have a situation like that, because of the underlying problem of complications during pregnancy, we see a manifestation of a certain kind of learning disability in the child. So yes, I totally understand what you're saying, Olu Busayo, regarding certain health complications that are somewhat, related to the manifestation of a learning disability in a child. I want us to move to the most significant aspect of this conversation now that we've been able to bring to the front burner what learning disability is, the struggle with, learning, basically for simplification purposes. Let's define it as that. We've spoken about some of the risk factors. We've also spoken about the social aspect of all of this. So let's talk about the intervention. I can understand that you have to curate a certain structure of teaching for these students. It might be a tad bit, you can, should I say, work it out so that the curriculum also includes them. But then because of the difficulty that they experience, there might be certain interventions that would be necessary. So talk to us about some of the individualized, intensive, remedial structures that you have to put in place as the learning support unit of the British International School. What are some of the curated, individualized, systems that you put in place to help the students so that they're not lagging behind from their peers?
All right, so when we talk about giving them individualized program, okay, after assessing an individual or a student, you find out the particular problem that the student is struggling with. For example, if the child is having problem with dyslexia, you planned the support you are giving that student based on the areas that he's challenging with. Is it spelling? Is it comprehension? Is it writing? So you plan the activity you are going to carry out with that based on the problem that the child is having. If it is those that are struggling with mathematics calculations, so you find out the aspect of mathematics they are struggling with. So you plan the activity you are carrying out with that student based on that area. So that is how we plan the support we are giving to them.
Yeah, Isaac, let me hear your perspective on this as well.
Okay, yeah, thank you. Yeah, just like Mrs. Yema rightly talked
Said.
about. Yeah, an assessment is brought forward by a certified assessor, an educational psychologist, and when that assessment is done, so the IEPs, individualized educational programs, are drawn based on the result and the data gotten from that assessment, and it is personalized to address that specific needs. Like she rightly said, under dyslexia, a child might have challenge with writing but not reading. So the plan or the program is tailored to that specific challenge that is needed. And in BIS, the learning support unit, we promote inclusiveness. So so there are times when they, of course, they also get to learn with their peers, and there's a time when they come for that specific support, so that we give them a broad and a balanced program that does not totally exclude them from learning alongside their peers, but gives them that holistic and inclusive environment to thrive.
I mean, I was going to ask you that question, but you took the words right out of my mouth, because I know that a lot of students with learning disability might sometimes feel ostracized, excluded, because they have to go through all these special classes, and that kind of speaks to their social and even emotional health. They are wondering, why can I not be in the class with my friend? Why do I have to attend all these special classes? Aside from helping them with their academics, I mean, you also have to cater to their emotional needs and help them understand that we're not excluding you because we don't think you're fit to be with your friends. It's just that you have a situation and we're trying to help you manage it. So how do you also deal with that aspect, of taking care of students that have learning disabilities?
Yes, like I rightly said, we in BIS we promote inclusiveness. So they spend time with their peers in classroom. Then there are times when they come to the unit for that individualized plan that we have for them, so that they are not excluded, and we can have a platform where they have this sense of belonging, and they don't feel like
I'm an outcast.
like an outcast. And we promote this because we live in a society where certain individuals feel those who have special needs are misfit for the society, but it is not so. And it's also a plea to the government as well to make our schools more inclusive, so that these specific individuals also are able to achieve their potentials, and also be able to fit in
Function
and be
as a member of
included,
society.
and be included in the programs and the plans that the society as a whole have for them.
All right, Busayo, let's hear from you, because I know that this is practically what you do. You're an interventionist. So, aside from helping with the academic difficulties of students, what systems do you employ to help them manage their social and economic parts of their lives?
Okay, it depends on the age that the child is.
Okay.
Like we have those that are very young in school, we facilitate them in the classroom such that they are able to be at par with their peers in the classroom. And then we have a time that we pull them out to run a one-on-one program. And then we ensure that we have some of them who do not have social skills. So we have to teach them how to socialize too. With probably harder kids in the class, extension, everybody, wants that they are coming across. Because we have kids that they prefer to be on their own.
Right.
Play in isolation. They don't want anybody to come near them. So, you have to teach them how to play with others, how to be able to relate with others.
Right.
So, and then there are some that we are saying co-mobility. You still need to teach how to dress self. You still need to teach how to feed. So it's part of what you do, what we do. So then if you are not talking about economic aspects, we are dealing with adults that we are teaching independent living lifestyle, how to live independent lifestyle.
Right.
For instance, if you come to me and you're telling me your child is like from 16-year-old and you're asking for a school, and then probably you are just starting on, the child is still having an IQ of a 6-year-old. Am I expecting you to go and put your child in a 6-year-old classroom at 18 or 19 or 16? No. So it is better for us to start teaching that child independent living,
Right.
self-care needs. Do you understand? To be able to take care of their environment, take care of themselves, to be able to at least go out for shopping, relate with others, and not all of that.
Right.
Do you understand?
Yes,
So
thank you.
Busayo. Yeah, okay, thank you.
Yes, no. You're going to speak to something very briefly. We are very, we're running out of time, actually. So let's talk about the treatment and management. At least for now, we don't exactly think that there's a particular cure for learning disabilities, unless it happens tomorrow and science has a breakthrough. But then I'm quite certain that the condition can be managed. So can you run us through the list of medical practitioners that are involved in the management of children with learning disabilities? Who checks what? Who does what? Who helps them with what? Give us that particular list, and then we can have final words from Uzioma and Isaac here in the studio.
Okay, for me, I use Nobelova Grandoni, they are in Bagada, that's Elino Shikoya, and then I have 2 developmental pediatricians, then Lutz. I got most of my clients are referred to me from Lutz.
Oh, no, we're not talking about, I'm sorry, we're not talking about the facilities where they receive treatment. We're talking about the experts involved. Is it physiotherapy? Is it a child psychiatrist? That's what I'm asking. Yeah.
You have educationalists, you have people who run assessment. Sorry. Sorry.
Yeah. Okay, you know what? Take your time and settle down properly. Let's talk to Isaac and Uzioma. The stigmatization of these students. Do you see it happen on a daily basis? And I think that ushers us into the conversation of public sensitization, because you can only be a part of something that you understand. So, what do you think we need to do, or what efforts do you even make as the learning support, unit of British International School, at least in your immediate environment? What is the stigmatization like, and how well do you think the public is sensitized on learning disability, which of course translate to how they even treat those who have learning disabilities. Let's talk to Ozioma first. Please, very briefly.
Okay, so when we talk about stigmatization, we find out that people do things because they are ignorant. So when you enlighten people on certain circumstances surrounding their environment, they will behave better. So when students are not aware that in students that have learning disabilities, they don't have sickness, they will welcome them, they will associate with them, they will help them in any way they can. So when we talk about giving them learning support, there are 4 major things that we do in that aspect, and one of them is student support, one of them is counseling, one of them is feedback, one of them is in area that brings about bringing their assessment report and diagnosis report. So when the students are enlightened about what learning disability is and how it affects others, it will help them to associate with them. It will help them to help after the class, they will associate with them and teach them the aspects that they do not understand in the classroom. So when they are knowledgeable about it, they will be able to do the positive things.
Right. Thank you very much. So, Busayo, we have less than 2 minutes. So, if you can,
Okay.
in 1 minute, just give us final words for the
Okay,
day.
we have for experts that you can seek for intervention. You would be needing, like, for especially writing skills, you'll be needing occupational therapists. You will be needing, sometimes when you have dealing with Down syndrome, even some ADHD and autism kids, they need physiotherapy.
All right.
And then
Go
we
ahead.
need ABA experts. Some people who have speech challenges would be needing speech therapists. So most times it's a teamwork. Sometimes a child does not need just one professional. A child might be needing a team of professionals to work with them.
Right. Okay,
Yes.
well, thank you very much. I appreciate the fact that you worked within the 1 minute that I allotted for that final part. So this is where we'll draw the curtains for the conversation. I did have with me here the Learning Support Unit of British International School, Ozioma Ike, who's the head of Learning Support, a certified dyslexia and autism specialist, as well as Isaac Nwali, who's the assistant head of Learning Support and also a certified dyslexia specialist. I did have students from British International School as well, Teramola Oluwatuyi and Mufara Tireoluwa Kola Alabi, and joining us virtually was Olubusayo Temitope Oshoba, who's an interventionist, the founder of Recare Helpmate Services. She's a certified behavior analyst and international behavior analyst with 15 years of experience. Thank you so very much for coming to the studio, for enlightening the public about learning disabilities, and hopefully this little effort of ours helps in the sensitization process of people, and we will help improve their acceptance of students with learning disability. Enjoy the rest of your day. Thank you so much for being here, and Olubusayo, thank you for your time as well.
Thank you very much for having me.
Yes, that's it for Mother and Child on Mainland 98.3 FM. Of course, there are lots of shows lined up for your listening pleasure, so don't touch that dial. It's still the sound of Lagos, Mainland 98.3 FM.
Every day I dey pray for you. Oh, in my heart.
When the airwaves in your market